If your child has a sore throat or fever, is it a cold or is it something more serious? Here to talk with me about that is pediatrician Jacob Sheff. He's with Providence to give us some important tips on how to handle a situation like this. So, Dr. Sheff, what sort of illnesses are you seeing in kids right now?
It is cold and flu season, and with that, we always think of RSV as well. And there was a little increase in COVID when it all began. But right now in my practice, mostly seeing colds.
So, of those illnesses that you see, of course, colds and everything else, what's the most concerning for you?
The one I worry about most this time of year is a lower respiratory tract infection. So colds are upper respiratory, sore throat and sniffles. Lower respiratory tract infections are going to be working really hard to breathe, kind of breathing really fast, respiratory distress, and often a high fever. I also worry this time of year with sick kids about dehydration. And so that's why when kids are sick, we tell parents to push fluids, kind of monitor how much they're taking. And if parents are worried about dehydration, that's another reason they should have them looked at again.
When's it time for a kid to see their doctor or to head to urgent care?
Yeah, I would say if your child's really struggling to breathe or they're just really not looking well, I tell parents trust their instincts. They know their kid best, so they should just have them looked at right away.
When a kid gets sick, they're starting to recover. When's it safe for them to go back to school?
I always tell parents that once your kid has been fever-free for a day and they're starting to feel better, their symptoms are generally showing improvement, then it's safe for them to go back to school or daycare.
So let's talk about vaccines. When should a child get what vaccine?
Yeah, it's a good question. So the flu and COVID vaccines are both available for children 6 months and older, so I definitely recommend it for kids of that age, especially if they're at risk of serious illness from either infection. The flu vaccine is best given before the flu season starts or early on in the flu season. Now we do have some RSV vaccines that just became available. When they're more readily available, I'm going to be giving them to children 8 months and younger going into their first RSV season. And then for kids between 1 and 2 with risk factors for severe illness, they'll get it going into their second.
Okay, that's good to know. So for parents who have a newborn at home who can't get vaccinated, what can they do to protect their kid?
As you can imagine, that comes up quite frequently where kids are born during the, let's say, flu season. In that situation, I advise that both parents and everyone living in the home get vaccinated against the flu. Then they're lowering their chances of getting the flu, which then reduces the risk of the little one getting infected.
Is it possible for a child to get RSV and COVID at the same time?
Those co-infections can happen. You can get flu and RSV at the same time as well. Fortunately, they're not very common, and when it does happen, it doesn't guarantee a more severe illness.
If you're looking for a primary care doctor for your family, contact Providence Medical Group at 503-582-2185 or go to providence.org/PMG.